Have you ever thought about all the things you touch when you leave your home? Maybe it's a gas pump, a grocery cart, getting cash from an ATM, or perhaps just waiting to cross the street.
Wait.
The CDC says it's possible for people to get the coronavirus by coming into contact with contaminated surfaces. There are now tests available to determine whether someone who has the virus has touched or breathed on the spaces we are in. Philogen, a San Francisco-based company, provided us with a surface test kit to show you how it works. You dip a swab into a solution and then swipe. We're going to be swiping a keypad on an ATM machine. Then you put the swab tip into a tube and send it to a lab. These $400 kits contain material to do as many as 25 tests. Results are available in 48 hours. We swabbed high-touch areas and places that people breathe on in and around Baltimore City.
Going up.
Like elevator buttons and this escalator handrail at a busy mass transit hub, a gas pump, a chair in a pharmacy waiting area. We swabbed a boarding pass kiosk at the airport. There are some places where it's not appropriate to bring a camera, but we're going to check it out. We tested plexiglass in the donut section of a grocery store as well as the glass in the cashier area. Dr. Andrew Pekas is a molecular microbiology professor at Johns Hopkins Bloomberg School of Public Health.
But viruses can survive on surfaces from anywhere from 6 to 24 hours.
If someone came in contact with a surface that had the live virus on it, how would they become infected?
If the virus is present on a surface, the most likely way you would then get it is if you touch the surface with your hand and then you brought your hand close to your nose, your eyes, or your mouth.
We swabbed playground equipment, restaurant tables, a dining room chair and bar. We swabbed several electric scooters, even some mail. Inside a taxi, we tested a door handle, seat belt, and dividing plexiglass. The swabs were sent to a Philogen lab for analysis. All the tests came back negative. Is Maryland doing something right? What kind of insight can you provide on our results?
They were either very recently cleaned, which is a good thing, or there wasn't somebody nearby who was carrying the virus that shed the virus onto the surfaces that you sampled.
Philogen founder and CEO Dr. Jessica Green says the test is designed to help determine risks.
What it does indicate is whether or not anyone who is carrying COVID-19, whether they're showing symptoms or not, is bringing the virus indoors, and also where in the building they're shedding the virus. The value of this is that it's a way of going beyond temperature checks, as an example, to know if you've got, infected occupants. And it also can provide valuable information about the way that we're reopening our spaces.
Doctors and scientists say touching contaminated objects is not the primary way the coronavirus spreads. They believe you're more likely to get sick from droplets, from a carrier's cough or sneeze. And tests like this one will help determine whether there's a problem at your office, school, or where you frequently visit. For the 11 News I-Team, I'm David Collins.